and welcome to our next Red Sky Health discussion, where I'm very excited to be joined by the founders of Red Sky Health to talk more about what it is that Red Sky Health is, why we came about, what we see as the value of bringing AI into the insurance claims world and solving that problem. So I'm going to ask each of the founders to introduce themselves briefly, and then we'll get into some questions I have to cover for you. Carter, tell me who you are and what you do, please.
Hi, Doug. My name is Carter Samuel. I basically am in the business of healthcare where I own medical practices and billing companies. And that's pretty much what I do.
Cool. Dean?
Hi, Doug. I'm the co-founder and CEO of Red Sky Health, and I have led technology companies like Red Sky Health from startup through acquisition and IPO.
And Dalton.
Hi, Doug. I'm Dalton Hahn, co-founder of Red Sky Health, along with Dean and Carter. I've spent my entire career in technology, enterprise technology, and sales, and built solutions for various companies in different verticals, such as finance and healthcare, and now in health insurance claims.
And so, as you can tell, we've got a pretty strong leadership team here and the founders. So let's just jump into it, because I think it's always good to understand kind of the genesis of where a company comes about, what drove the need. So Carter, as we look at this, what inspired you to help create and contribute to Red Sky Health? And how did you identify the problem or problems that you wanted to solve for healthcare providers?
So Doug, what basically happened was, in being in the business of healthcare and owning both medical practices and billing companies, denials is extremely systemic. So I felt the pain on both ends, from both the provider side as a business and both on the billing side as a business. But what really probably hit the point hard to me was that we actually had a couple in one of our practices that got sent a bill, a very hefty bill for a hospital bill that actually was denied. And when a claim gets denied, you naturally send it to the patient as a bill, but it shouldn't have been denied. It was actually done incorrectly, the billing, and it should have been paid. The provider should have been paid. The patient should have never gotten the bill in the first place. And luckily we knew the couple very well, but it caused a lot of issues, and it made me think. And I've known Dalton for over 15 years, and we started talking, and we said, you know what, this is a huge problem. Nobody has been able to solve it. I don't care what anybody says. They have not. It only gets worse. So we decided to get Dean involved and put our heads together and try to figure this one out.
I like that. I like the human touch behind that. And there's a good reason behind this. So Dalton, anything you wanted to chip in with that?
I was talking to Carter a couple of years ago, and from late night discussions and kind of iterating the idea in our head, what originally started out as something that could solve his problems for his businesses, which medical practices. Basically, we said to ourselves, you know what, this can help the entire industry. And fundamentally speaking, it's not about just getting denial paid. It's about everything that leads ultimately to better healthcare for patients, right? If the system works smoother.
Yeah, that makes sense. So Dean, you spent a lot of time in the early part of Red Sky Health, helping to drive, fundraising, working with the investors. But obviously, you drove this because you saw the opportunity that Red Sky Health could bring, not just financially, but to help people. When was a pivotal moment for you early on when you said, you know what, our solution can really make a difference for both providers and patients?
Well, Doug, when my good friends Dalton and Carter first came to me, I am not from the healthcare space. So when I wrap my arms around health insurance denials, I first thought this was a small problem. And I was then informed there's actually $4.5 trillion of claims submitted every year to the health insurance carriers in this country. And on average, 15% of those claims are denied, mostly due to clerical and administrative errors and mistakes in the claims. So it's actually a huge problem. And I looked at the problem along with Dalton and Carter and others to see what solutions have been provided in the past, and none of the solutions worked. They've tried call centers in the United States to call the insurance companies. They've tried call centers in India, a lower cost area, to try to call the insurance companies. Rules-based products that would apply rules to these claims. None of these things worked, and it became clear to us that Using AI, which is very good at looking at patterns in huge data sets and adjusting accordingly, was the way to solve this very difficult, long-standing, intractable problem.
Makes sense. Makes sense. Carter, anything you want to piggyback on that? Since again, you live this world.
I mean, he hit it on the head. We try to outsource. I happen to be of an Indian background, so we outsource to the area that I'm from, which is the billing capital of the world, which is South India. And they didn't really understand, a lot of them didn't understand, especially like I'm based in Cleveland now, the narrow insurances, coal miners insurance. There's a lot of Googling done. There was a lot of mistakes being made. And then, the idea of rules-based engines, which have been out there for a while, what really put that, I think, out to pasture was COVID. Because when COVID happened, rules changed very quickly, back, and it was constantly changing by different payers. And you can have any rule based you want, but if you're changing it every year and COVID's happening in real time, it just didn't work out. So this was even prior to before anyone knew what the word GPT was. We decided that we were going to go through the data that we had and start using data to actually come back real-time data to figure out what the fixes were.
Yeah, and we talk about make mistakes being made and rules changing. I think that's one of the, I don't know, one of the neat superpowers that Red Sky Health has, because it can pull from that data, it can update things, it begins to eliminate or at least prevent the majority of mistakes that are being made from the billing standpoint. A lot of power there. So Dalton, you and I spent a lot of time talking about the why, which is outside of the business aspects, really more the humanistic part of, bringing technology to market. So when you look at what we're doing with Red Sky Health and what you've done in the technology world, what are some of the values and guiding principles that drive you and the team as we build technology for this complex healthcare technology system?
The U.S. healthcare system, on the one side, I would say provides the best. You can find the best healthcare in the world in the U.S. On the other side, I feel that it's a chaotic system, and it's not easy for your average person, which I would say I'm an average person, to get good healthcare. And so basically, when I looked at this, I was in healthcare because of technology, and I looked at it from a point of view of companies like health insurance carriers and health insurance providers. They're all trying their best for their own interests. And for me, the reason why when Carter brought this up to me and why what's important to me is that ultimately patients need to get the best healthcare possible. And when it's not about enriching health insurance carriers or making sure that doctors provide expensive treatments and those type of things, is making sure that the system works well, that services are paid for, and that ultimately the patients don't get bothered for bills that should be paid, right? And so that's what kind of drove me. Yeah.
I like that. I like that. So, Dean, let's as the guiding the CEO running all this whole crazy mess. Obviously we're in this business to make money as a company, but we're also in this business to do something for people. Anything you want to add there?
Yes, absolutely, Doug. We're in business not only to make money, but we're in business to do good. And what drives me and a lot of the engineers and other people that work for Red Sky Health is that if we can put in place a system that allows group practices, clinics, and hospitals to collect more of the dollars from insurance companies that they're supposed to be collecting for the medical services rendered, they can in turn offer better health care, which is a great value to everybody. So I think that's a little bit of a guiding light that drives me and many other people at Red Sky Health.
Awesome. Makes sense.
Can I piggyback off that one?
Please.
It's a very important point that Dean brought up. To just give you a scenario, if a primary care doctor is not getting accurately paid for the services that they've done anyway, the care could falter. For example, a doctor might feel that he has to see 40 patients in a day, rush his time in order to make the certain amount of revenue in order to pay his bills. But if he was just accurately paid and efficiently paid for the services that he did, he can give better care by giving the quality time. He doesn't have to feel rushed, for lack of a better phrase. And at the same time, if the patient is getting billed for something they should not be getting billed, they suffer. So it's an entire trickle-down effect and a circle effect that affects the entire healthcare system. We're basically cleaning up those gaps.
I think you just nailed Red Sky Health's value proposition. So that's awesome. That's very true. Let's keep the camera on you, Carter. One of the things you talked about initially was the challenges you had in trying to get billing processes supported, et cetera. What are, when you look at barriers to innovation when it comes to healthcare, whether it's communication, technology, what are some of those barriers to innovation, and how does Red Sky Health help us to get past those?
The main barriers I would say is there's a lot of legacy systems. There's a lot of different systems out there. Luckily, we have data formatted in certain ways that we can actually traverse it properly. And at the same time, we happen to just be at the age where AI is blowing up, even though, I can honestly say that we started this before anybody was really in the whole AI world, but we were able to, it's not me, Dalton, or really even Dean, it's really the guys that work with us. They're the real brains. They figured out ways to make sure that we can actually properly traverse the data, come out with accurate recommendations. That's the key from Red Sky. We don't tell you what to do. We tell you what to do exactly for that claim in order to get that claim fixed. That's really the difference between us and them. And, they're able to figure it out, make it effective for our clients, and thus get the claim paid. So there's a lot of battles with different systems and different technologies out there, but putting it into one cohesive system that we can discern it through our AI models and then give back accurate actions for the payers, for the providers to get paid properly is really what I think, I'm very proud of.
Cool. Cool. Dalton, anything you want to add there as our technology guru?
Well, there are people in Red Sky Health that know a hell of a lot more technology than I am, and I think we've done a really good job of surrounding ourselves with really smart, capable people. But what Carter says is right. It's about basically finding a way to help, particularly medical billers and people that are resubmitting the denials to get accurate answers in an automated fashion.
Yeah, I like it. And you touched on this a bit earlier on, but let's dive into this a bit more briefly. So looking ahead, as Red Sky Health continues to succeed, which we're doing well on, what is your vision for how Red Sky Health's work is going to change the healthcare experience for the two groups we care the most about, providers and patients?
The way I look at it is on the health insurance carrier side, health insurance carriers have been using AI for a while now, and they use it for processing the claims. And you wonder why isn't AI being used more on the healthcare provider side, on the patient side? And I thought about this quite a bit, and to me, the carriers, the health insurance carriers, they're making the rules basically. It's like walking into a casino and playing against the house, right? The house always has that slight advantage, right? Because they're the ones who are making the rules, and they get the percentages for them. And so healthcare providers have always had to be reactive to what they're doing. Now AI totally changes the picture to this, right? AI speeds up the reaction that providers have for the carriers, right? In a recent report, 2/3 of denials never even get resubmitted. They don't have a chance of getting corrected and paid for. And this is where we're changing the odds here.
Right. I'm going to finish with you, Dean. I'll throw one over to you. The last one. Any last thoughts you have on the vision for the change we're going to bring?
Yeah, Doug, I just think that by getting providers, whether they're in group practices, clinics, or at hospitals, to be able to collect the money that they rightfully deserve, we can just really right some of the wrongs that are out there in the healthcare business right now. Allow them to offer better care, allow them to operate their practices and clinics and hospitals in a way that's financially stable. What we've seen in the most recent past is it's very difficult to operate a practice. Many of them are losing money, if not just marginally profitable. You used to have hospitals. There's no such thing anymore as a hospital. There's only a group of hospitals because the regional hospital of yesterday wasn't collecting enough revenue to stay afloat. As a result, they've been rolled up and they've been accumulated by larger entities, and now you have groups of hospitals. So this is our mission. We want to make healthcare a better place and be able to let providers offer better care by letting them collect more of the revenue that they rightfully deserve.
Great. Before I wrap up, Carter, anything you want to add as we finalize?
Just to sum up what Dean and Dalton just said, I mean, we're in the business of leveling the playing field. And by leveling the playing field, as Dalton said, the insurance carriers and the payers have AI. They're the ones that write the checks. They're the ones that reject the claims. If the playing field is level and the providers are properly getting paid, right? They benefit, then they give better care. The patients benefit, as I said before. This is the AI age. We just happen to have formed this business out of a pain point that we live every single day. We're not a bunch of guys that thought this up in the shower. We live this up. We wanted to solve a pain point, and AI happened to be born at the same time. I don't want to say born, but flourished during the same time. And we're leveling the playing field so that the providers get paid, the patients don't have to pay when they don't need to pay, and care is just ultimately given, and it's better care. And I think it's about time that that side of the business had the proper tool in order to get to make it effective. And I think that's what we deliver.
Spectacular. And this has been very continuing education for me. Hopefully the people watching this have gained some insights, not just on the founders themselves, but behind the mission for Red Sky Health. And the next step really is, if you're watching this and you're saying, yes, these are problems I want to solve for my organization, the easiest thing, get a demo with us. Our demo, everybody who watches it says, yes, that makes sense. I need to do this. So the best thing is reach out to us. I'll put the information, the contact in there, have a conversation. We're here to change how healthcare is being handled in real time, solving problems, making a difference for the providers and the patient. So again, founders, I really appreciate your time. Carter, Dalton, and Dean, thank you. If you have any questions, please reach out to us. We look forward to talking to you.